Good morning. I'm going to tell you about the effect of small molecule P75 neurotrophin receptor inhibitor on amelioration of Detrusor sphincter dyssynergia following spinal cord injury. And I have nothing to disclose. P75 neurotrophin receptors act differently depending on co-receptors. They form complexes with and for example, with TRK receptors, they cause cell survival. With sortilin, they cause cell death. And this particular complex with sortilin has high affinity for proneurotrophins, the uncleaved forms that are highly released soon following spinal cord injury. LM11A31 is a selective small molecule inhibitor of exactly this interaction. And it's been shown to be safe for oral administration in clinical trials for Alzheimer's disease. Our model of spinal cord injury is complete transection of level T8-T9 in mice, some of which were gavaged daily with 100 milligrams per kg per day of this drug, starting 7 days following injury. And we've shown that 2 weeks following injury, the bladder becomes much bigger and its weight is almost 4 times higher than in control bladders. And we saw both urothelial layer and detrusor layer hyperplasia. And we showed that the treatment with LM drug reversed these changes and saved bladder morphology. Also, the bladder weight was much smaller than in untreated animals. Urine spot test showed that this drug did not have much of an effect in spinal cord intact mice. It showed that 2 weeks following spinal cord injury, mice already have Detrusor sphincter dyssynergia because the amounts of urine voided were much lower than in controls. And we showed that the amount of urine voided in treated animals was increased dramatically. So these were the simultaneous recordings of cystometry and external urethral sphincter electromyography. And we showed that in control animals there is long intercontractile interval, relatively low bladder pressures, and as the bladder fills, the sphincter activity goes up, representing guarding reflex here. When bladder contracts, the tonic activity of sphincter goes down, allowing the micturition to occur. Also, unlike in human, in rodents, both mice and rats, there is so-called bursting, the phasic activity. In spinal cord injured mice, 2 weeks post-injury, there was detrusor overactivity, as well as when the bladder contracted, the tonic activity of the sphincter increased, representing Detrusor sphincter dyssynergia. Also, we showed that the frequency of this bursting was decreased. Daily administration of LM11A31 starting 7 days post-injury diminished Detrusor overactivity and also ameliorated DSD, which is shown as the appearance of intervals of low tonic activity of the sphincter during bladder voiding. Also, bursting frequency was increased. In conclusion, we say that this drug ameliorates spinal cord injury-induced Detrusor sphincter dyssynergia and Detrusor overactivity, improves lower urinary tract function, voiding efficiency, and bladder wall morphology. Thank you.
Any question from the floor? Well, I have a couple of questions. In spinal cord injury management, timing seems to play a big role. So the first question is, when do you think is the best time? Immediately after the injury, or can this way work even if it is done, later on, and for how long? Mm-hmm. So is this supposed to be a continuous treatment, or the idea is to do it for a certain period of time, and when the lesion is settled, you don't need to do it any longer?
Right. So we had some studies done previously when we started giving this drug a day before the injury, and that was obviously very, very effective. And obviously it's not very clinically convenient. You're not supposed to give drugs before the injury. And I can say that definitely it would probably be the best to give it as soon as possible after injury, because the pro-neurotrophins are released at the moment and during a few hours. We've shown that they increase dramatically. But also I can say that in spinal cord injury patients, I think there is ongoing inflammation pretty much chronically. And inflammation was tied to pro-neurotrophins and neurotrophins released as well. So I assume that even if you can't give it as soon as possible after injury, it can still be helpful, at least in diminishing inflammation in chronic spinal cord injury. And as in regards of how long it has to be given, we gave it pretty much until the point of experiments. I don't think there is any data showing the detrimental effects of this treatment. So, frankly speaking, I don't know. We didn't try short treatments. But I think it would be useful, again, talking about inflammation and things, to give it longer rather than...
I'm Mike Ruggieri from Philadelphia. This certainly is a very exciting molecule and probably got a lot of potential. I think some of your work from your group showed that this pro-NGF is starting to be produced within hours after the transection. Where do you think it's coming from?
So that's a good question, because I think it was shown that it can come from urothelial layer. Yoko is going to present another paper here in regards of the neurotrophin receptors location in the bladder, and it's interesting data. I think it can come from urothelium. I think it can come from kidneys, maybe in urine.
So how does the urothelium know it's got spinal transection that soon after the transection? It's only a couple of hours.
Say it again, sorry.
How does the urothelium know that it's spinally transected after a couple of hours? I mean,
Well,
it's still connected to the spinal cord. It's still receiving those spinal innervation.
The nerves release, obviously, the neurotrophins probably too. And nerve release a lot of factors following spinal cord injury very soon after.
So you think it's the lack of the central inhibition coming down from this big ganglion on our shoulders?
And it's actually also shown that urothelial layer is disrupted very soon after injury, so it knows.
Thank you. Very good.
One last question. Any possible side effect in the long term from a pharmacological standpoint? So
far not known, to the best of my knowledge. I think it's undergoing a second or third clinical trial in Alzheimer's disease. Sorry, I can't pronounce it.
Okay.
But so I think first clinical trial is where it shows the safety, right? And it's past that.
Okay. If no other question, thank you very much.
Thank you.